Good afternoon, and thank you all for standing by. I would just like to inform all parties your lines have been placed on a listen-only mode until the question-answer segment of today's conference. If you'd like to ask a question, that will be star one. Today's call is also being recorded. If you have any objections, please disconnect at this time. I will now turn the call over to Margaret Farrell. Ma'am, you may begin.
Great. Thank you so much, Terry, and good afternoon, everyone. I'm Margaret Farrell, and on behalf of the National Cancer Institute, I'd like to welcome you to the January Research to Reality Cyber Seminar. NCI launched Research to Reality Community of Practice 6 years ago now, with the aim of bringing together researchers and practitioners in an ongoing discussion around the promise as well as the perils of moving evidence-based cancer control programs and policies into practice. And our speakers today aim to do that, to introduce and discuss the recently released call to action on walking by the U.S. Surgeon General, and to give a glimpse into the policies, systems, and environmental changes necessary to fully implement Step It Up, as well as the key partnerships that make such work viable and sustainable. And to this end, we're delighted to welcome Jackie Epping, who is the lead public health scientist and team leader for the Guidelines and Recommendations team of the Physical Activity and Health Branch at the CDC. Jackie has had a lead role in the development of resources, physical activity guidance, and technical assistance to a host of initiatives at the national and state levels, and most recently with the Step It Up call to action. Jackie will be joined with a colleague, Kelly Kavanaugh. Kelly is the active living consultant for the South Carolina Department of Health and Environmental Control. Central to the implementation of the call to action is the need for communities to promote more walkable communities and more equitable community design. Kelly is the right person to talk about this because she's responsible for providing active living subject matter expertise to communities and professional planners throughout the state of South Carolina. And Kelly will be speaking about her work and the lessons that they have learned in South Carolina. Complete biographies of our speakers can be found on researchtoreality.cancer.gov. Following their presentations, we'll reconvene and host a robust interactive discussion with you about your experiences and give you the opportunity to pose questions to our speakers. If at any time during the presentation you would like to join the conversation, please press star one to be placed in queue to ask your question live during the Q&A portion of our seminar. Or if you prefer, you can also submit your question using the Q&A feature at the top of your screen. You just type in your question and then hit ask. We specifically and warmly welcome those of you who are joining us for the first time to engage in the discussion today both on the call and online with our R2R community of practice. Thank you all for joining us today. So, Jackie, with all of our housekeeping done, I'm delighted to turn this over to you and Kelly. You may begin.
Well, thank you, Margaret, and thank you everyone who's on the call for giving me this opportunity to talk with you today about Step It Up, the Surgeon General's call to action to promote walking and walkable communities. I'm talking to you about the call to action because it's strongly grounded in science and thus provide the recommendations in the call to action are all grounded in research findings. Excuse me. 1 out of every 2 U.S. adults is living with a chronic disease such as heart disease, cancer, or diabetes, and we know that these diseases contribute to disability, premature death, and health care costs. We also know that physical activity can reduce illness from chronic diseases and reduce premature death. It helps prevent risk factors such as high blood pressure and weight gain, and it protects against multiple chronic diseases. In children and adolescents, it can improve bone health, cardiorespiratory and muscular fitness, and body composition. People who are living with chronic disease also benefit from being physically active. For example, physical activity can lessen the severity of their condition as well as prevent disease progression and premature death. It can help manage or reduce symptoms and improve mobility. Among adults, physical activity is associated with improved quality of life, emotional well-being, and positive mental health. It's also important for healthy aging and may delay the onset of cognitive decline in older adults. In children and adolescents, evidence suggests that physical activity can lower levels of anxiety and depression, and when it's part of physical education, recess, classroom lessons, or extracurricular activities, students can also improve their academic performance. To obtain substantial health benefits, the 2008 Physical Activity Guidelines for Americans recommend that adults get at least 150 minutes of moderate intensity aerobic physical activity or 75 minutes of vigorous intensity or an equivalent combination each week, and that children and adolescents be active for at least 60 minutes each day. People who aren't active and those who don't yet meet the guidelines are strongly encouraged to work toward this goal. Adults with disabilities who are unable to meet the guidelines should avoid inactivity and try to get regular physical activity according to their abilities. Despite the myriad of health benefits, only half of U.S. adults reported levels of physical activity consistent with the guidelines in 2013, and only 27% of high school students reported levels of physical activity that met the guideline for 60 minutes a day in 2013. Why focus on walking as a public health strategy? Walking is an excellent way for most Americans to increase their physical activity. It's also a powerful public health strategy for several reasons. It doesn't require special skills, facilities, or expensive equipment, and it's easy to begin and maintain. Most people are able to walk, and many people with disabilities are able to walk or move with assistive devices such as wheelchairs or walkers. Walking has a lower risk of injury than vigorous intensity activities. It may also be a good way to help people who are inactive become active because it's easily adapted to fit one's time, needs, and abilities. It's also a fairly common form of activity. For example, in 2010, more than 60% of adults reported walking 10 minutes or more in the past week for transportation or leisure. People can walk for many purposes, such as for transportation, to get to school, work, a store, or the library, or for leisure, to have fun, socialize with friends or family, walk their dog, or improve their health. Because it's multi-purpose, it provides a lot of opportunities for people to incorporate physical activity into their busy lives. And communities can also benefit when they implement strategies that make them more walkable and when more people walk. For example, communities designed to be walkable can improve safety not only for the people who walk, but for all community members. They offer opportunities for personal interaction and social involvement, people on the street, eyes on the street, if you will. Walkable communities have the potential to reduce air pollution and greenhouse gases because people may choose to walk or bike rather than drive. And finally, walkable communities are attractive places for businesses to locate, which may help local economies thrive. Even though it's a popular form of physical activity and it can be easily done by most people, barriers to walking do exist. People report lack of time as one challenge that prevents them from walking or doing other kinds of physical activity. They may struggle as they cope with competing demands of work, school, home, and caring for themselves and others. Safety concerns can also be a barrier to walking, such as unsafe driver and pedestrian behaviors and challenging physical environments. Perceived traffic dangers may also be barriers to walking. In surveys of parents, the most commonly reported barrier for walking to school was distance to school, followed by traffic-related dangers. Fear of crime or perceptions of an unsafe neighborhood can also be potential barriers. The way communities are designed and built can present barriers to walking. For example, when everyday destinations are located too far away from home, walking is not a convenient option. Because people are more likely to walk when they use public transportation, the lack of an adequate public transit system may mean that opportunities to walk are lost. Disability, chronic conditions, and age can also be barriers to walking. During 2009 to 2012, 11.6% of U.S. adults reported a disability, and adults with disabilities were more likely to be physically inactive than adults without a disability. Chronic conditions and age can make it difficult for people to walk. For example, people with arthritis may find walking painful, and older adults and those who are frail may be reluctant to walk because of concerns about falls and subsequent injury. Ultimately, individuals make the decision to walk. However, the decision to walk can be made easier by programs and policies that provide opportunities and encouragement by walking and by improvements to community walkability. And I'll say that Kelly is going to talk to you more concretely about what some of these things are. Improving walkability means that communities are created or enhanced to make it safe and easy to walk, and that pedestrian activity is encouraged for people of all ages and all abilities. All of the sectors that you see here have roles to play in increasing walking. There are 5 goals in the call to action and several strategies, and I'm going to take you through those now. The first is to make walking a national priority. This includes encouraging people to promote walking and to make their communities more walkable, and to sort of create a walking movement, a national walking movement, to make walking and walkability a national priority. I think of this goal as very much related to raising grassroots support and awareness. The second is design communities that make it safe and easy to walk for people of all ages and abilities. Designing and maintaining streets and sidewalks, and designing communities that support walking. And here are some examples of actions. The decisions and plans made by the transportation, land use, and community design sector can affect whether communities and streets are designed to support walking. This sector can change community and street design through roadway design standards, for example, zoning regulations, and building codes. Community design can support walking by locating residences within short distance of stores, work sites, public transportation, essential services, and schools, and by building and maintaining sidewalks or paths between destinations that are well-connected, safe, and attractive. Street design can also support walking through measures that improve street lighting, provide street furniture and landscaping, and reduce traffic speed. Transportation and travel policies and practices that create or enhance pedestrian and bicycle networks and expand or subsidize public transit systems can be another approach to encourage walking for transportation. Goal 3, promote programs and policies to support walking where people live, learn, work, and play. Schools can provide opportunities for physical activity through PE, recess, after-school programs, and physical activity breaks, and walking can be incorporated into those opportunities. They can provide safe routes for students to walk to and from school, and open school facilities like gyms, playgrounds, fields, and track to the community during non-school times. Work sites can offer access to on-site facilities or employer-subsidized off-site exercise facilities. They can adopt policies that include brief physical activity breaks, flexible schedules, walking meetings, and incentives and social support programs can also be used to encourage employees' interest and participation. Volunteer and nonprofit groups can provide access to facilities, programs, and information to promote walking. For example, they can open their facilities and walking programs to the wider community for free or at low cost, or they can organize social support programs. These organizations can also serve as messengers to share information about the benefits of walking and walking programs and ways to improve walkability. Public parks offer access to places to walk. Health and fitness facilities can offer group walking programs and access to places for walking, including places to walk indoors, particularly important in certain parts of the country and often for older adults. Better access to parks, playgrounds, and recreation centers can encourage active transportation, such as walking to the location. And it's important to remember that facilities need to be designed, built, and maintained to be safe and accessible to the entire population, including people with mobility limitations or chronic conditions. Goal 4 is to provide information to encourage walking and improve walkability. Healthcare professionals can assess patients' physical activity levels and educate them about the importance of physical activity. And walking is an especially good activity for healthcare professionals to promote because most of their patients can walk, and walking can easily be modified to a person's ability. Walkable campus strategies help students, faculty, and staff adopt active living behaviors on campus. And colleges and universities can also educate and train future professionals to recognize their role in promoting walking and walkable communities. This training could be not only directed to students in health disciplines, but also other relevant fields like architecture, transportation, urban design, and business. And the media can be very effective in influencing attitudes and changing behaviors, including health behaviors. Media campaigns can be part of an effective multi-component intervention designed to increase physical activity. The last goal has to do with filling gaps in research, surveillance, and evaluation. For example, walking among adults is assessed through self-report in several surveillance systems, but not in a consistent manner. And surveillance systems that assess walking among children and adolescents mainly collect data on walking for transportation. Improvements are needed to establish standard and valid measures of walking that can be used across systems at national, state, regional, and local levels. Additionally, no national surveillance system currently routinely and comprehensively monitors local neighborhood features related to walkability. We need tools or technological approaches that can capture the most important aspects of walkability. Existing research demonstrates that multi-component interventions increase physical activity, but it's rarely known which set of individual elements are most effective, necessary, or sufficient to achieve a positive effect while minimizing any negative effects such as injuries. And finally, communities across the country are implementing a variety of interventions that promote walking, but many of these interventions are not being adequately evaluated. The evaluation data would be strengthened by the use of common metrics across studies so as to allow comparison of the relative cost and effectiveness of various interventions. Finally, public health professionals can conduct research and evaluate programs to determine what works to promote and sustain walking. They can summarize findings about what community approaches work, and they can help other sectors design and implement interventions. They can convene partners across multiple sectors to learn from each other and to develop strategic action plans that efficiently use each partner's expertise and resources. Public health professionals also collect data about walking and walkability to measure and monitor changes over time. Promoting walking really does offer a powerful public health strategy to increase physical activity. And with the call to action, the U.S. Surgeon General, Dr. Murthy, calls on the nation to better support walking and walkability for all people. To do this, communities need to be designed to make walking safer and easier. Programs and policies need to be available to support and encourage walking, and individuals and families need to support each other to become and stay active. Many partners are already involved, but more engagement is needed to increase the reach, breadth, and impact of these efforts. Walking is an easy and inexpensive way to improve the health and well-being of all Americans, so we say now is the time to step it up and make walking a national priority. And incidentally, you can access the call to action, an executive summary, the Surgeon General's playlist, and some infographics and a short video at www.surgeongeneral.gov. Thank you again, and now I'll hand the mic over to Kelly.
Thank you, Jackie. That was a great overview of the call to action, and it's also a great segue into our work here in South Carolina. So hello, everyone. I'm, again, Kelly Cavanaugh, and I'm the Active Living Consultant for the South Carolina Department of Health and Environmental Control. And today I'm going to be highlighting how we're stepping up here in South Carolina through our Healthy Comprehensive Planning Project. You know, Jackie did an excellent job highlighting the 5 goals of the call to action, and in some ways this project speaks to all of these, specifically designing communities for walking. So to better understand what this project is, why we chose to do it, and how it fits with the Surgeon General's call to action, I'm going to first briefly discuss the relationship between health and planning here in South Carolina. Then I'll walk through the Health and Planning Toolkit, both what it is and how you can use it in your communities. And I'll close by discussing our statewide promotion, targeted technical assistance, and monitoring activities that are occurring here in the state. So first, a little background on the relationship between public health and planning. So historically, the two fields began working together around the early 1800s, where poor community design had led to public health issues such as overcrowding, cholera, influenza, and other diseases. This revelation then led to new zoning regulations that are now embedded into today's planning field. However, at the time, the focus was really on preventing communicable diseases, and therefore there was less, if any, forethought on how poor development patterns affect the chronic diseases we're now seeing in today's society. With high rates of cancer, obesity, and metabolic diseases, we're now trying to re-engage the planning field in order to develop communities that promote a culture of wellness, specifically through walkable and connected community design that is accessible to all users. So here in South Carolina, we've been building a relationship between public health and planning professionals through a statewide system approach. This effort was initiated through the South Carolina Healthy Comprehensive Planning Project, which began as an idea to address health through a statewide system focused specifically on improving community design. Research shows that population-based physical activity can be improved through transportation policies and through urban planning and design. However, at the initial stage of this project, we did not feel that in South Carolina, state-level transportation policy change was an option for us. We looked for another way to approach system-level change. We did, however, have a great history of success working with local-level planners on active community design, so we started investigating ways to address community planning on a statewide scale. We also decided that if we're going to address community design to improve physical activity, then we should really use this as an opportunity to address access to healthy foods as well. That's when we brought together public health and planning professionals to determine what is the best approach for South Carolina. So this group of professionals that came together is referred to as the South Carolina Health and Planning Advisory Committee. Formed in 2013, this committee plays an instrumental role in connecting the fields of health and planning in South Carolina, and they're tasked with deciding how to address healthy eating and active living through planning efforts. The slide you see here lists all member organizations that are represented by the committee. So this includes the Planning Perspective, which is represented by the South Carolina chapter of the American Planning Association, the Public Health Perspective, which is represented by Eat Smart, Move More South Carolina, and the Department of Health and Environmental Control, and the Agricultural Perspective, which is represented by the South Carolina Department of Agriculture. You also see that also Planning Design and the Georgia Health Policy Center also served on this committee, and they served in the consultant role because of their successful history in addressing physical activity and access to healthy foods through planning. Later, faculty at Clemson's University School of Planning, Development, and Preservation were also added to the committee after being identified as a stakeholder in South Carolina in planning efforts and as a key partner in educating future planners here in South Carolina. So prior to bringing the South Carolina Health and Planning Committee together for the first time, we contacted several planners to get ideas about how to impact health through the state's planning infrastructure. We learned that in South Carolina, legislature requires that any county with a zoning ordinance is required to have a county comprehensive plan. So county comprehensive plan is essentially the vision for the county. This is a document that must be adopted by county council before any other plans, policies, or regulations can be developed, such as zoning, facilities, city works, transportation, etc. So in other words, it's really the foundation for planning in which subsequent policies must be aligned with this plan. So for example, if you want to pass a policy, so let's say a complete streets policy, and there isn't language in the county comprehensive plan that supports this type of work, the county doesn't have to consider this policy. However, if the comprehensive plan does say that the county supports, quote, policies and programs such as complete streets, then county council must support the policy if and when it is brought to them for adoption. Now, this is not saying that there wouldn't be editing involved, but they do have to consider the policy because it is in their comprehensive plan. So here in South Carolina, we have enabling legislation that requires all jurisdictions that impose land use and zoning regulations to have a comprehensive plan in place. This plan must be executed by a planning commission. It's reviewed every 5 years, and it must be updated every 10 years. So, for example, in South Carolina, we have 46 counties, but only 45 of those counties have land use and zoning regulations. Therefore, those 45 counties must abide by these rules. So, since this comprehensive plan is really the foundational policy that sets the stage for all subsequent policies in the state, and because there are only 46 counties in the state compared to over 200 municipalities that must abide by this law through subsequent policies, the South Carolina Health and Planning Advisory Committee specifically chose to target county comprehensive plans. So after conducting a review of the literature, the group also decided that this would be a key opportunity to integrate language that support both active living and access to healthy foods through a toolkit. Although the intent of this toolkit is also known as the Health and Planning Toolkit, focuses on county comprehensive plans specifically, the information contained in the resource can also be used for additional local planning efforts as well. So now let's talk a little bit about the toolkit and its contents. So the South Carolina Health and Planning Toolkit was developed in 2014, and it was updated later in 2015. The toolkit is a healthy eating and active living policy guide that aims to understand, evaluate, and impact local planning policy here in South Carolina. The slide you see now shows you what the toolkit looks like, and it gives you an idea of its contents. It's hosted on the Eat Smart Move More South Carolina website, and it can be accessed through the link you see above. The toolkit is specifically written towards 4 main types of users. These include local government professionals, public health professionals, elected officials, and advocates and interested citizens. The toolkit has an easy-to-follow layout with 5 main sections, as you see here. So this image, as well as the next few slides, all come directly from the toolkit. So the 5 sections include how to use this toolkit, why public health and planning are important in South Carolina, the Healthy Eating and Active Living Policy Guide, and a section for resources. So to utilize the toolkit and update your comprehensive plan, there are 4 easy steps. So the first step is pretty straightforward. You need to go and find your plan. So every county and local government has an adopted comprehensive plan. So you should be able to contact your county, municipal planning, or public works departments to get a copy. Next, you'll need to review and score the plan using metrics outlined in the toolkit. The Healthy Eating and Active Living Policy Guide chapter will explain how to do this. The third step is to analyze and identify areas for improvement. There are tools listed in the resource chapter that can help you analyze your community, identify geographically where to take action, and to help you develop goals and action steps that are appropriate for your community's needs. And then lastly, the final step is to collaborate with stakeholders that have an interest in healthy eating and active living within your community. So some key groups you might want to engage include government departments, such as health departments or planning departments, nonprofit or advocacy groups, elected officials, and business groups. So you'll need to work with your county's locally planning process to update these plans or to create new ones that integrate healthy eating and active living. So as I mentioned in step 2, there's also a scoring component to the toolkit. The scoring criteria that's used for this effort comes directly from the American Planning Association's publication, which is called Healthy Planning, an evaluation of comprehensive and sustainability plans addressing public health. This publication is a best practice tool for evaluating comprehensive plans, and therefore we decided that we should use the same one for the toolkit. The scoring criteria will help address whether a public health indicator is present, and if so, how explicitly the indicator is addressed, or how specific or action-oriented the policy is. So a 0 indicates that the indicator is absent from the plan. A 1 means that the indicator is present, but it's limited in scope. And then a 2 means that the indicator is present, comprehensive, and or specific. So within the toolkit, there are 67 best practice indicators that address healthy eating and active living. These indicators are grouped together by topic areas. So for active living, we have 6 topic areas, and these include bicycle and pedestrian connectivity, access to open space, parks and trails, safe routes to school, land use and transportation, support facilities, policies, and programs, and implementation and evaluation. And then for the healthy eating topics, there are 5 areas, and these are food production, food processing, food distribution, food access and consumption, and implementation and evaluation. So the great thing about this toolkit is that for each indicator, it also provides recommendation for policy language improvements. The slide you see now is an example that comes straight from the toolkit. So the indicator is, quote, prioritizing sidewalk development and intersection safety improvements within close proximity to school sites. The goal of this indicator, as stated, is to create an environment where residents can walk and bike to meet their daily needs. Then an example of how you would integrate this into the policy is listed. So here it says, prioritize pedestrian facility improvements on school routes within 1/4 mile of schools. Then when we were finalizing the toolkit, we went ahead and used the metric criteria to analyze all 45 comprehensive plans in South Carolina and see where we stood on existing policy language. And while we did this, we thought this would be a great opportunity to pull out language of examples of counties that address the indicator in their comprehensive plans. So again, at the time this was analyzed, these counties had never seen the toolkit, but took it upon themselves to integrate healthy eating and active living into elements of their comprehensive plan. So the example for this one is from Fairfield County, and they address this indicator by acknowledging that not every school-age child rides a bus to school, and stated that, quote, for kids who live near the school and walk to school, they must have a safe place to travel. Areas within 1/4 mile of schools should have the highest priority for sidewalk improvements. They then go on to provide a time estimate as to how far this is. So here they say it's about a 5-minute walk. So as you can see, the toolkit is not only a prescription for policy language updates, but rather a tool that provides goals and examples of how to integrate healthy eating and active living into planning policies that you can adapt to best fit your county's comprehensive plan. So once the toolkit was developed, the advisory committee moved into phase 2 of the project. This included statewide promotion, targeted technical assistance, and monitoring. So the following information you see may be an example of how you could use this within your communities. So at the local level, we reached out to specific planning departments that are currently reviewing or updating their county comprehensive plan and offered them access to a professional planning consultant who is also a member of the South Carolina Health and Planning Advisory Committee. So the consultant provided peer-to-peer assistance by working directly with the county planning department to review their comprehensive plan and to utilize the toolkit to provide recommended policy language updates. So this is the first time we've done this, but we're also using this as an opportunity to learn what kind of assistance do counties need and how long does it take to provide this assistance. The ultimate goal here is for these counties to improve their plans by including healthy eating and active living best practice language. Our anticipated outcome is that hopefully this will prioritize healthy eating and active living and will impact how the community designs how the county is designed over the next 10 years. We've also targeted local planners by presenting the toolkit at statewide association meetings, such as the South Carolina Association of Counties, the South Carolina Association of Landscape Architects, and the South Carolina chapter of the American Planning Association. We also tried to reach out to the Association of South Carolina Mayors and the South Carolina Economic Developers Association, but our timing didn't quite align. So as an alternative way to reach a similar audience, we've contacted the Urban Land Institute and was able to develop 3 in-person sessions here in South Carolina to discuss both their Healthy Places initiative as well as our Health and Planning Toolkit. And these sessions are actually scheduled to take place next week. Targeting statewide meetings has been beneficial as an opportunity to disseminate the toolkit in person to planners, but it's also been an opportunity to educate them on what the toolkit is, how to use it, and how to use it. So the presentations typically include kind of an overview of the toolkit as well as a short interactive session on updating examples of comprehensive plan language using the toolkit. So then at the state level, we've conducted regional workshops with public health and planning professionals in South Carolina. South Carolina is divided into 4 public health regions, and we held 1 workshop in each region, so 4 total. These workshops were promoted by the South Carolina Health and Planning Advisory Committee, as well as the networks of our community members. Similar to the presentations at the statewide association meetings, the workshops were also gave us an opportunity to introduce the toolkit, demonstrate how to use it, and help foster collaboration between planning and public health professionals. And lastly, as I mentioned before, we went ahead and analyzed all plans here in South Carolina just to get an idea as to how well are these indicators actually being addressed in comprehensive plans. This allowed us to help determine what type of technical assistance was needed at the local level and how to approach this. It also allowed us to determine a baseline so we can observe and determine if counties were increasing policy language that supports active living and access to healthy foods moving forward. So through the development of the toolkit and the analysis of our own county's comprehensive plans, there are certain items that we learned. So for one, comprehensive plans tend to be oriented towards private development and public infrastructure services. They're primarily focused on future growth, development, and economic development. When they do focus on health-related topics, it's often done indirectly and not explicitly. Secondly, references to public health are often related to public safety. When public health is referenced in comprehensive plans, it's often related to public safety services, such as police and fire services. 3, metrics and action items related to public health in comprehensive plans are rarely, if ever, stated. We did find that action steps with performance metrics or goals related to healthy eating or active living are severely lacking in comprehensive plans. And without specific action items to guide implementation efforts, it will be difficult to track policy performance over time. 4, access to and an understanding of health data may be a limiting factor for public health policy and comprehensive plans. Health data related to healthy eating and active living was not incorporated well into comprehensive plans, and therefore it typically wasn't included as a part of the data collection and analysis elements of the plan. By improving access and an understanding of health-related data, we can improve public health policy in these comprehensive plans. And lastly, we found that local governments are not reviewing and updating their comprehensive plans consistently. So not only does access to comprehensive plans and their adoption of information vary greatly, but we found that local governments are not consistently reviewing and updating their plans in line with state requirements. So, in conclusion, while there are some challenges with comprehensive plans as a whole, there has been an increased amount of interest in the state regarding the toolkit from counties who are both updating their plans, whether or not they're receiving technical assistance. There appears to be an interest at the local level, so it'll be interesting to see how the toolkit is utilized and how the state of practice changes moving forward. And so to close, Jackie mentioned 4 goals of the Surgeon General's call to action. And in some ways, the South Carolina Healthy Comprehensive Planning Project speaks to each of these. We're making walking a priority here in South Carolina, and we're doing this by improving policies that support walking where people live, work, and play. This, in turn, will help planning professionals to design communities that make it safe and easy to walk for all people of all ages and abilities. We're also using the toolkit as a means to promote information to planners statewide to encourage improvements for walking connectivity. And we're also going to continue to monitor how the utilization of the toolkit will promote improved connectivity and therefore walkability here within South Carolina. So with that, I thank you all for taking the time to be here today. I hope that this presentation has given you some ideas of how to make the linkage between public health and planning in your state. So thank you, Margaret and Jackie as well, for allowing me to join you, and I'll hand it back over to Margaret.
Great. Thank you so much, Kelly, and thank you very much, Jackie, as well. What a great presentation and such a great tone to start off like a year of programming here on Research to Reality. It's so nice, isn't it, when the two perspectives come together so seamlessly. So thank you to you both for your time in the presentation. This seems like a great time then to open up the phone lines and give you an opportunity to join the discussion. So we invite you to please press *1 and you can be placed in the queue to ask a question or share your experiences live now during the Q&A portion. Or if you prefer, you can also submit your questions for either or both of our speakers using the Q&A feature at the top of your screen. You just have to type in your question and hit ask. I know there are a number of you who are on the line who are calling from different active living programs in different county and state health departments. So we'd really be very interested in hearing from you about your experiences and your lessons learned as well. So while we're waiting for people to queue up with questions, either by pressing *1 or using the Q&A feature at the top of the screen, I do want to loop it back then to Jackie and just, as a follow-up to Kelly's presentation about the different sectors that South Carolina was able to engage, what resources do you find most helpful in working with states and in getting them on board with increasing walkability and having them endorse some of the activities around the call to action?
Well, we're actually in process right now of developing some action guides. So one of them is going to be on complete streets, implementing complete streets policy. Another one is going to be on master plans at the MPO level, and another is going to be on joint use or shared use agreements. So those are a few that we have under development here. There are also really a plethora of resources. The Environmental Protection Agency, EPA Smart Growth Group, has put out some really nice guides in the last couple of years on making the business case, for example, making the economic case, and various issues related to developing communities that are more walkable. I don't have the names of those at the top of my head right now, but I know that if you Google EPA publications or smart growth publications, that you can come across those.
That's great, Jackie. Thank you. And we'll post some of those onto the Research to Reality site as a follow-up to the discussion. Thank you.
Sure.
And Kelly, I was struck by your presentation by the breadth of partners that you're able to engage along the way. And just curious, which of the partners that you were able to bring along in this program were you most surprised to be able to leverage and able to engage? Was there anybody who came to the table that you weren't expecting?
I wouldn't necessarily say were. I would say for me, at least because I'm the active living consultant and I have a healthy eating counterpart, I think for me, having the agricultural side was surprising, but in terms of but they've been great too, by the way. The Department of Ag and the South Carolina Community Loan Fund, those two were probably the most surprising, but they've also been great additions. But from a planning perspective, the South Carolina chapter of the American Planning Association has been a huge asset for us, and I think that by engaging them, it's really opened up doors and relationships with other planners in the field. And I think had we had not engaged them, then I don't think that, this may have come to fruition. They bring a wide variety of experience, and they really know their stuff. They've also helped us to identify bringing in faculty from Clemson, for example. So we had not thought of that until actually after the toolkit was developed. But, realizing that professionals in South Carolina get trained. And so if you can integrate the toolkit and an understanding of why it's important while those folks are being educated, then you're approaching the system on many different levels. And so Clemson's been a great addition for that, but I think that had we had not engaged the folks at the South Carolina chapter of the American Planning Association, then we really would not have gotten this far.
No, I think that's a great point, Kelly, and thank you. We have a question. We have a few questions coming in online, and our first one's from Deirdre Stockman, who asks, have any local comprehensive plans in South Carolina been updated to include public health and active living goals and metrics as a result of the efforts that Kelly reported on? Kelly, can you speak to any of the local implementation? Thanks.
Yeah. So that kind of goes back to our targeted technical assistance. So at the moment, we're working with 7 counties. And the process has been relatively slow. Based on some of the outcomes, again, we learned that they're not updating them consistently, and there are some challenges with that. And what we've learned, too, is that sometimes it gets outsourced. So sometimes they have a consultant doing it. So at the moment, we are working with those 7, and there are many planners in the state, again, who have access to these toolkits, but as far as I know, there's only one to date that has utilized it, but that group still has not gone through a formal adoption process. They're in the process of getting public comment, and then it'll go up for adoption. Once the plans have been updated and formally adopted, then we will do a reanalysis to figure out if the toolkit was being utilized and how the targeted technical assistance, if that was an effective measure of providing local level assistance. So right now I would say no, we're not quite that far, but we're making strides in that direction.
Great, and thanks, Kelly. And we're certainly hoping to hear back from you as it continues to progress. A question from Denise Lanza, who asks, we're a county park and recreation agency that has recently received a grant to start working on the plan to create walking connections in communities, initially using our county parks as a foundation for these connections. Congratulations on your funding, Denise. That's great news. We're focusing our initial efforts on communities with challenged populations. What are your recommendations for where we should start? And she ends with, thank you. Kelly or Jackie, maybe both of you probably have some perspective on this. Where would you suggest that they start in working with the populations?
Well, this is Jackie. I'm not sure if I'm going to be answering your questions, so let me know if not. But there are opportunities to walk in parks, but there's also a movement afoot that the National Recreation and Park Association is really involved in called Safe Routes to Parks. And so one place, to start might be identifying some neighborhoods or some areas of community that are somewhat proximal to a given park and work on creating a Safe Routes to Park initiative, if you will. I say initiative because, that just like with Safe Routes to School, that can mean programs, it can mean policies, and it can mean actual physical infrastructure, crosswalks, crossing guards, striping, street lights, that kind of thing. But, if I were going to do this, I think I'd start small and work the bugs out with one or two neighborhoods where we've got, a pretty decent chance of having some success, and then scale it up and out from there.
Yeah, I think Jackie made a really great point, and I'm just going to highlight on some stuff. So I guess my question is, what type of, when we say challenge populations, what are we really saying? And is the challenge populations, are we really talking about like elderly folks and kids and more of an access issue, or are we talking more of a structural issue as well? So some groups you might want to consider are bringing in, like AARP has been a really big advocate. And so if we want to look at engaging seniors to feel not only safe, but that they have access to get around, I would really suggest getting into that group, as well as like neighborhood safety and police kind of departments. So that way you're getting at two things. You're getting at groups that may not feel safe or comfortable to walk and may not be like the biggest users, but you're also getting to the kind of the crime prevention side of stuff. And I'm just saying that because here in South Carolina, in the meetings that I've gone to with our region folk, our, challenge populations are kind of those are two groups that we look at. And Jackie made a great point about work maybe with one or two neighborhoods at first and go from there. And maybe when you do that is to bring them together in like a community process and get them in a room and think, let's try to figure out why aren't we walking to the park more often? Is it a safety issue? Is it an infrastructure issue? And then do some walkability assessments. Take both, maybe have like a child come with their parents, because walkability from a child's point of view is also going to be much different. So there are things that we don't take into consideration with kids and the way they see the world, as well as perceived safety. And then also make sure that you might have someone with a disability who also is participating in that walkability assessment, because, again, their challenges are going to be very different. So I would say whoever is in your challenge population, invite them to the conversation, invite them to the community meetings and those assessments to be able to give the input and to create a clearer picture of what the landscape is and how to better connect them.
Great. Thank you both. We'll take one last question from Sharon, who says, what about guidelines for new construction to encourage health behaviors, like construction that includes welcoming stairs versus stairs with enclosed fire stairwells. Stairs are a great way to encourage exercise. Elevators and escalators have become the trend and are easily accessible. And she writes that we need to make stairs easily accessible and viable as well, and visible as well. Is stair walking part of either of the initiatives that both of you are familiar with or working with?
Yes. So through those sessions I mentioned that are upcoming with the Urban Land Institute, the Urban Land Institute has multiple resources available on their website, and I believe one of them addresses specifically indoor healthy places. And so the stairwell, making it at the front of the building and easily accessible and people know where it is, that is one of the strategies that is outlined. So I would check their website because they do have a lot of great information on that.
And this is Jackie. We actually, well, for one thing, one of the recommended strategies in the Guide to Community Preventive Services for increasing physical activity has to do with increasing stairwell use. And we actually conducted a study here at CDC a number of years ago where we took one of those old, dark, dank, couldn't find it kind of stairwells and step by step did things like painted the walls, installed carpet, put artwork on the landing, put little reminder signs by the elevators and so on, and finally pumped in music and saw with each of those additions, increase in stair use. What we also learned is if you don't keep on the horn and if your messages are not culturally relevant to the people who are using the building, it's not going to fly. The other thing that I've learned personally is that it's, having accessible, attractive stairways makes sense. It makes sense at almost an intuitive level, but what we've learned is that a lot of our grantees, a lot of state health agencies, and others who've tried to get that going have run into real serious challenges. Even in the building I'm in at CDC here on my campus, what we learned is that for emergency evacuation, for example, there are certain requirements to where the stairs can be located and how you can shut sections of the building off from the stairwells if there's a fire and those kinds of things. Our compromise was still wide, attractive stairwells with windows, but they had to be at either side of the building. And then, of course, for people with that are physically challenged, when stairwell or stair use is not convenient or easy or sometimes even possible, that's a consideration as well. So we don't call stair use out per se in the call to action, but it is a way to walk more for a lot of people.
Oh, and thank you both, and thanks, Jackie. I think that's a great note to end on, and thanks also for the for linking in the community guide too. We'll be putting the resources that are mentioned, some additional questions that are coming in, up on the Research to Reality website, and invite all of you to join our speakers to continue the discussion online at researchtoreality.cancer.gov. You'll be receiving a link to a feedback survey in just a few minutes, and we look forward to hearing from you and seeing you at the beginning of February for our cyber seminar on the economics of cancer control as part of the World Cancer Day events. We'll be focusing on the economic cases for cancer control and how to work across groups to to put a price, and also to be able to cost out benefits of our cancer control efforts. So building on a lot of the topics mentioned today for sure. So thank you so very much, and thank you again to our speakers, to Kelly and to Jackie. We're really doing such a great job both of setting the tone for the session and to being so generous with your time. So thank you all very much for joining us, and thank you for our speakers, and we look forward to seeing you online at Research to Reality. Thank you.
Thank you, Margaret.
Thank you.
Thank you. That does conclude today's conference. You may disconnect at this time.